Hi everyone, Gabby here, owner and clinical director of Recovered and Restored Eating Disorder Therapy Center. I wanted to jump on really quick and say hi. I also just wanted to talk about today accessing a therapist. Reaching out for help and therapy can be really challenging, and taking that first step is really brave. So, where do I start? I think the first thing is asking yourself, do I want to access a therapist who is private pay, or do I want to use my insurance? Also, since the pandemic, there's another question to ask yourself of, do I want a therapist who's in person or virtual? In our practice, we are fully virtual, and that gives you the ability to meet with a therapist from the comfort of your own home. I think it adds an extra level of comfortability for the client. And I will say also for the therapist, it gives us a unique snapshot into your life in your area, which I think is really cool. So we're fully virtual, but there are plenty of therapists out there that are in person if that feels valuable to you. So first, we're going to ask ourselves, do I need to use my insurance, or am I able to pay out of pocket? Also, do I want in person or virtual? Once I've answered these questions, I can start my search. Now, if you are seeking out services at Recovered and Restored, we are private pay. That means that we don't accept insurance. I know that may feel challenging, but what we do offer is something called sliding scale fees, which is where we have set rates for each provider based on level of expertise, also based on what they love working with, and where they feel their rate should fall. And we can adjust that based on your financial need within reason. We unfortunately can't do it for everyone, but we do our best to meet people not only where they're at in the therapy room, but financially when we can. There are also options out there if you're struggling with an eating disorder, such as Project Heal, that can sometimes help contribute to your cost of sessions, or can help you negotiate a rate. Also, sometimes the insurance companies will help you with something called a single case agreement. And if the provider, like us, agrees to that single case agreement, then you don't have to worry about it. But let's say you are going to go the private pay route. Then what you're going to want to do is figure out what feels most important to you about a therapist. So if it's someone who's warm, if it's someone who specializes in EMDR, or if it's someone who specializes in DBT, or if it's someone who is seasoned, right? Like they've been doing therapy a long time. What feels important to you? Because this is your therapy experience. This is your journey, right? So you get to decide. You are in control of all of it. And again, it is just so brave. You're even watching this video, you're even thinking about therapy and getting ready to heal. So we've decided whether we want virtual in person. We've decided if we're able to pay privately, or if we need to access our insurance. And then we've decided what feels important to us about having a therapist. What qualities are we looking for? Okay, then we can head kind of to the internet. I will also say, before we jump to the internet, you may want to ask your primary care. You may want to ask your coworker who you know goes to therapy. You may want to ask your neighbor, right? Or someone you feel safe and comfortable with, maybe a cousin, a friend, a mom, whoever. Because if they've been in therapy, word of mouth referrals is like probably the best way to get connected with someone who's going to be a good fit for you. Because most likely the person you're asking knows you on some level and also is endorsing whoever they're referring. I will say, whenever we receive a word of mouth referral, especially from a former client, it just means the world to us. And typically what happens is we are a good fit for that person because they were referred for a reason. So I'd say start with who you know. Who do you know goes to therapy? Who do you know likes their therapist? What do they like about their therapist? So just having conversations around therapy with safe, comfortable people who may be able to give you a word of mouth referral. Or if that's not feasible, if that's not possible, let's head to the internet. Type in therapist near me, or virtual therapist in, let's say you're in New Jersey, or eating disorder therapist in Pennsylvania, right? And start there. And then from there, do some research, call around. It's okay to want to interview your therapist. A lot of us do what's called a discovery call. Now, I do them for my whole team, but depending on where you go, sometimes you get to speak to the clinician directly. Sometimes you don't. Like here, you would talk to me, and then I will do my best to match you. But you can do these discovery calls or these consultation calls to help you make sure that you're finding the right fit. And then once we've done maybe the research, we've done the discovery calls, we've picked our therapist, right? We schedule. And sometimes that's the hardest part, is actually doing it, right? Like taking the plunge, accepting that we have to make some changes. We can't allow our eating disorder, our OCD, our depression, whatever it might be, to continue impacting our lives, right? So then we schedule, we go to the intake. Intakes are meant to be non-threatening. It sucks having to tell your story again. As someone who has had to retell her story a few times or a few hundred, I get that. That is so incredibly valid. And you're allowed to tell your therapist that. You're allowed to say, hey, I've already told this story 7 times. So like, here's what I can tell you today, right? Also, I'll speak just about us, but I would say most of the people we partner with, you're allowed to pass. If you're going through the intake and you're starting to feel overwhelmed, stressed, or scared, share that. The therapist wants to hear your feedback. You're allowed to say, hey, I can't answer that today, but in the future, I'd like to talk about that. Fine, or just pass. I'm not ready to go there, right? However you need to say it, whatever feels safe and comfortable for you. But therapy can be accessible. It is valuable. I will speak just about in New Jersey right now, because that's where I'm located. There are both private pay and insurance-based therapists that are accessible and accepting clients. I think it's just a matter of doing the research, knowing deep down what you do need help for, taking that brave step. So we're going to ask our community, we're going to ask our tribe, who do you guys like? Who have you tried? Who do you think could help me? We're also going to ask other professionals in our lives, primary care doctors, OBGYNs, maybe we have a dietitians, whoever, we feel safe and comfortable to share that we might be ready to go on our healing journey. And then we're also going to jump to the internet. We're going to Google therapist near me, virtual therapist near me, eating disorder therapist near me, EMDR therapist near me, whatever things feel important to you. Google it. Google is your friend. It's annoying at times, and it does mean that you're going to have to do some legwork and make some calls and send some emails, but all of those things are doable. Then I'm just repeating myself so that it feels easy and concise, because I know I jumped around a little bit. After we, reach out, we send the emails, we're going to do most likely a discovery call, or you're going to speak with the owner, hopefully, or you're going to speak with someone like an intake coordinator who is capable of getting you on someone's schedule. Once you're on someone's schedule, going to do an intake. The intake can be anywhere from, I'm going to say 30 to 90 minutes. Most likely it'll fall somewhere in between like 45 and an hour. Sometimes you'll do the intake over multiple sessions. We do 45-minute sessions here, sometimes 50. So if you don't get it done, you don't get it done. No big deal. Again, you're allowed to pass on everything. We have so much empathy that you don't want to tell your story again. We will do our best to collaborate with former providers if that's an option. We also will let you take it at your pace. And I'll say not just me, a lot of therapists will do that. And I can specifically speak to the team at Recovered and Restored. We are here to meet you where you are at. We are so honored anytime someone new is on our schedule, because that means we're going to get to share in another healing journey. And that is just so special and so powerful. So you've done the intake, and then you get to start therapy. At the end of most intakes, people will give you a clinical recommendation. Not everyone will. Also, again, not every intake is done in one session. A lot of times in outpatient, someone might give a recommendation of you also need to add this member to the team, especially if it's eating disorder work. A lot of times we're going to want you to add a dietitian, or we're going to want to be in contact with your primary care, mostly because we want to make sure that you're medically stable and appropriate for outpatient. But the nice thing about outpatient is that everything's optional. So I will leave you with that. I hope that this felt helpful to you in some way of how to access therapy, how to kickstart your recovery, how to take that really brave first step. If you want to take that first step with us, please reach out to me, Gabby at recoveredandrestoredtherapy.com. Head to our website, recoveredandrestoredtherapy.com. Also, my personal number is on the website, so you can call me directly. You will speak with me. I will be the one to do your initial call. It can take as long or as little as it needs to. And if we can help, we would just be so honored. Also, if we can't help, we will connect you with our resource network. As a practice owner, it is my honor and also, I think, duty to be connected within the community. And I think I've tried my best to do that. So if we can't help, we will hopefully get you to someone who can. We are licensed in Pennsylvania, New Jersey, Delaware, South Carolina, Florida, and Maryland. So please know that if you are in any of those states and you are struggling, we would be so honored to work with you. And if we can't help, we are dedicated to do our best to try to find someone who will. Please remember that these videos are supplemental. They are not therapy. I hope that this encourages you, lets you know that therapy is accessible, also that recovery is accessible. And if you are struggling, don't hesitate to reach out. Bye, guys.